Hey YouTube, this is Amy. This is Proof Weight Loss Surgery Works, and I am your Wednesday vlogger. This week's question is actually the same as last week. We're rolling it over because of the meet and greet. I might talk a little bit about the meet and greet at the end as well. Here is the question. Do you still see your bariatric surgeon? When was the last time? Do you get your annual labs done? In case of a bariatric emergency, do you have a plan? A doctor or a hospital? Do you wear a bariatric medical bracelet? Have you ever suffered from any medical complication related to your bariatric surgery? I feel this question was for me. Maybe. It's been a topic of subject between me and a few of my friends that are concerned about me. I had surgery 4 years ago. I am having some problems right now, if you're unaware. Yes, I am super thin, and do I want to be this thin? No. I've actually dropped 18 pounds in the last little bit over a month due to some gastric problems I'm having, unable to eat, malabsorption, my vitamin levels are dropping, my protein levels are dropping, even though I'm taking in like at least 100 grams of protein in liquid per day. My labs are saying I am not taking anything in. So I am going through a ton of testing and everything right now. But the first question, do you still see your bariatric surgeon? No. When was the last time? 3 months post-op. Yep, 3 months post-op. I had my surgery, my VSG surgery, done by the Navy in 2009. Which was one of the first years that they had started doing them a lot, and this was before any other insurance was covering the VSG. I lost the question, but I remember now. So I had the surgery done. I went to my 6 month post-op appointment. Everything was good. My surgeon had deployed, so I just saw the nurse. They measured me, took my height, weight, sent me off to the lab. That's it. I was about a year post-op. Did the same thing. Had my labs done. Didn't need to see anybody. No complications. And after that, my husband got out of the military. And when he got out of the military, I didn't have insurance for about a year, and then we went and we got Kaiser. So I'm 4 years out, so it's a big block of time that I hadn't seen a surgeon. So I started with Kaiser. I got a primary care doctor, and I said, look, I had bariatric surgery. Can you do my labs? She didn't even know what labs to order for me. So they have a bariatric department, which is some nurses that specialize in it, I guess. I don't know. This is Kaiser in San Diego. I know a lot of you guys have Kaiser and you have surgeons, but there isn't an in-house surgeon in the Kaiser doctors in San Diego. They have to outsource. Because I didn't have my surgery through them and they don't feel that I need to see one unless there's a problem, they haven't sent me to one. They just have my labs done and send me to different departments. So with all my problems going on, I said, I think I need to see a bariatric surgeon now. And they said to me, this was, I don't know, 6 weeks ago when I started all the testing and everything. They said, it would take a while to refer you out to one, but they most likely will just send you to a gastro doctor. So they just sent me directly to the gastro doctor. So I've been working with them. But you know, 6 weeks, 18 pounds, not being able to eat, malabsorption, pain, bloating, nausea, you know, test after test after test. I have had an upper GI, an endoscopy. I have had a CT scan. I have had a stomach emptying study done. I have had every single lab that you could possibly have. Bowel or stool samples, crazy amount of stool samples. Yes, I have done everything and anything, and they still haven't figured it out. So I am demanding that they get a bariatric surgeon involved. There is a possibility I may have a diagnosis soon, but I'm not going to talk about it on this channel. I will talk about it on my channel because that's not really what the question's about. But I do not have a bariatric surgeon, but I do have a hospital and I do have doctors. I'm working with 2 doctors right now, and the bariatric department. So I don't have a bariatric doctor, but the nurses know what's going on, and they can send my information out if need be. Do I do my labs? Yes, I get my labs done every year, and I will continue to do that. I don't remember. Oh, have I had a medical emergency related to my weight loss surgery? Well, I am having problems now, but I don't know if it's necessarily related to my weight loss surgery at this point. Yeah. But let's talk about the meet and greet. I'm glad I went. I really did not feel very well at all. I really felt the toll of the whole thing when I got home, because I wasn't living out of a hotel room. I did take my protein shakes, but you know, carrying them around when you're out and about is hard. So I attempted to eat some easily digestible carbs that I've been able to eat a little bit of, just to give me some calories. In the end, most days that did not do me well, and I ended up needing to take a nap and lay down. Yeah, I'm like really upset with myself that Friday and Saturday both, during the day, I was in bed in pain most of the day, and I missed a lot. I may have been a little more inverted because of what's going on with me, and I think that if I was in better health, I would have been able to talk to a lot of more people and actually meet and greet and be a little more involved. But I am glad that I went. I think the event just looked beautiful. I think there was a lot of people there that looked amazing, and they were, you know, helping out a lot and motivating people to continue in their dreams, continue in this journey. The education was amazing. I can't wait to see what this foundation does in the future. I hope to still be part of the community. I don't plan on leaving anytime soon, but I probably will not be at the cruise. You know, it's just too much for me to get away for that long. But it does sound like an amazing event. So next year, I can't wait to see all the pictures of you guys all out there on that cruise. I will be working on getting a bariatric surgeon. If you are in the San Diego area, or you had surgery in the San Diego area and you have Kaiser, I would like to know who is the best VSG surgeon out there. So if you're watching this and you had VSG, buy Kaiser or a affiliate with Kaiser in the San Diego area, put that name down there so I have some people to request. I am Proof Weight Loss Surgery Works. See you next week. Bye.